Good morning, everyone. I'm Dr. Hemi Soneja from Max Smart Hospital. I'm a senior consultant in diabetes and endocrinology here. Today, we are going to talk about types of diabetes and the other common question which people have in their mind regarding reversal of diabetes or cure of diabetes. So, when we talk about diabetes, there are two main types, type 1 and type 2. Type 1 diabetes is the one which we see in younger children, younger adults. They're typically much thinner, much slimmer, and they have autoantibodies against the pancreas and against the insulin releasing cells, because of which they have issues with type 1 diabetes. In this, the main problem is with the insulin production in the body. So whatever insulin is required to cover for the fasting blood sugar levels and to cover for the food that we take in, that insulin release is not happening in the body. And this is the reason why these people, they need insulin for all of their life, and even from the beginning of diabetes diagnosis, they need to be on insulin. And typically they would need anywhere between 3 to 4 injections of insulin a day, and the dose of that needs to be modified over a period of time. A lot of times people think that this is just a young child who's been diagnosed with diabetes recently, and if the child is being started on insulin, the child is going to be dependent on that. Let's try and meet up with another doctor. So a lot of times they lose out on that initial crucial time where it is very important to get the sugars under control. Diet changes, they do help, but in a person with type 1 diabetes, they really are not going to be able to manage without insulin intake. So be mindful about that. It is okay to talk to one more doctor and consult regarding things if you're not sure about something. But I would not recommend that you keep looking for options that, can we treat this person without insulin? Not really an option in that. Now, talking about type 2 diabetes, that is the one which we see very commonly nowadays. The problem with type 2 diabetes is increasing over a period of time. Almost every other person that we come across over the age of 40 is suffering from either borderline diabetes or they already have diabetes. And I think in today's day and age, this lifestyle related problem is becoming a big problem. In this, basically, there is initially problem with insulin resistance in the body. The insulin is there, but it is not being able to work properly because of excess weight and lack of exercise and inadequate or improper diet. Further on, what happens is that there is issue with insulin production also. So in the initial phase, your diet, exercise and medications might work well for you, but over a period of time, as the insulin production starts decreasing in the body, you might need to use insulin at that point of time. A lot of times people have this reservation regarding insulin, a lot of myths which are there regarding insulin use, and a lot of those myths are actually not very correct. So common thing which people have is that once I start insulin, will I be dependent on that for the rest of my life? Not always the case. It's not about you getting dependent on that. If your body needs that, we do need to supplement it from outside if your body is not making enough of that hormone. It does not have any side effects compared to the oral medications that are being given for diabetes. The only thing it does in the body is to lower your blood sugar levels. Yes, it is important to check your blood sugar levels on a regular basis when you're taking insulin, but it is a very painless injection nowadays. Even 8, 9, 10-year-old kids, when they get started on insulin, we teach them how to use insulin by themselves. So they are independent and they can use insulin by themselves. So if you are okay to check your blood sugar levels at home, you're going to be totally okay taking insulin by yourself also. It is important to be in touch with your doctor and the diabetes educator who might be there as well. They can really help you go through this process very easily. A lot of times people have this question in their mind, especially when they're initially diagnosed with diabetes, is that how can I get rid of that, or can I get rid of that? Now, talking about type 2 diabetes in particular, there are a lot of studies and there are a lot of research coming up And we are actually seeing patients in our clinical practice as well who are being able to reverse their diabetes. They are being able to go down on their medication doses, being able to go down on their insulin doses as well, if they start following their diet particularly well. There are a lot of different diets which you might have heard of these days, like vegan diet, keto diet, other things like intermittent fasting. All of these different things, they have shown their own benefit. As with regards to medications, with these diets also, they have their own benefits and their own disadvantages. But overall, what we see is that if your diet is not adequate, if your diet is not in place, none of the medications or insulin are going to work for you. People who are overweight or obese, which means that their BMI is above the recommended range for their age, if they are being able to lose a significant amount of weight with diet changes and exercise and maybe use of certain weight loss medications, they are being able to get rid of their diabetes. They are being able to go down to non-diabetic levels in their blood sugars and being able to go down on their medications and being able to come off of their medications also. There was a research study which was done recently and it was published in one of the major journals last year in Lancet. It was called the Direct study, in which they looked at a total of 300 people. They divided them into two. Half of them were on a specific recommended diet and half of them followed their regular usual diet. Of the people in that 150 patient group who were following the recommended specific diet and were able to lose significant weight, so around 10 to 15 kg weight, the ones who lost that much, of those 86% of them were able to resolve their diabetes. They were able to reverse their diabetes, meaning that they were completely off of the medications and their blood sugar levels were down to the normal range. So it is definitely something which is doable and achievable, and if there is somebody who can do that, it's only you. Nobody else can do that for you. We can educate you, we can educate you about the tools which you can use for that, how to be able to achieve that target. And along with that, one of the important things to keep in mind is to keep a check on your blood sugar levels with that. Whenever you are making any kind of diet changes, it is important to keep a check on your blood sugar levels, because you will be surprised how rapidly and how dramatically they can really change with these kind of diet modifications. So, again, talking about the different diets, there is vegan diet, which essentially means that you do not take any animal products, no milk products, no eggs, no non-vegetarian food items, of course. And it has been shown to help with diabetes reversal in a significant way. A lot of times we see that, we have a lot of patients who are vegetarian and they would be like, okay, Dr. Saab, I'll stop having milk and curd. Will that help me reverse my diabetes? So it's not just about stopping your milk and curd to become vegan. It is more about emphasizing on those whole grain carbohydrates, the complex carbohydrates, lot of emphasis on raw vegetables, a lot of emphasis on fresh produce, and cutting down on processed foods altogether. So processed foods like all your biscuits, rusks, namkeens, all of these packaged items, they actually do have a lot of processed grains, and a lot of times they are fried, a lot of butter and everything which is being used. So these are the things, once you start cutting down on those, you're going to see significant improvement. So whatever diet you're on, important to cut down on all your processed foods, have lots of raw vegetables. So if we talk about one particular meal, if this is your plate, half of that you should keep in mind should be your raw vegetables. That is what is going to help you the most with being able to reverse your diabetes by helping you achieve weight loss. So weight loss is the key when we talk about diabetes reversal, and it is definitely doable. Persistence is the most important thing with this. Without that, nothing is going to work. It's not about that, okay, I've been following this diet for 1 week and I've not lost any weight and I've given up on hope. It is important to continue to work on that, and gradually you are going to see improvement in your blood sugar levels and your weight as well. So I would like to bring this talk to a conclusion and to an end, and say that diabetes, especially type 2 diabetes, is definitely reversible. It is definitely something which we can achieve a better outcome and a better cure of by being particular about our diet, about our lifestyle, even adding on those 2 minutes of breathing exercises, 10 or 15 minutes of exercise if you're not been in a habit of doing any. Even that much amount is going to be a good stepping stone towards you being able to improve your health and being able to decrease the risk of complications related to diabetes. Thank you very much.